ligaments of the liver, we have what we call falciform ligament. The falciform ligament separates the functional lobes of the liver, the left liver and the right liver. The falciform ligament cuts across these two, the left and the right. It joins with the ligamentum teres hepatis that is coming from the visceral side of the liver. And we said, as earlier we said, that this ligamentum teres hepatis is a remnant of umbilical vein, the one that brings nutrients from the placenta into the what? Into the fetus as the embryo is still growing. Then we also have what we call coronary ligaments. Coronary ligaments come from the falciform ligaments. We shall form what we call right and left coronary ligaments. As we come to the diaphragmatic surface here, then this falciform ligament bifurcates to form the coronary ligaments, the right coronary ligament and the left coronary ligament, the right and the left coronary ligaments. Then this coronary ligament, we shall also have what you call triangular ligament. The triangular ligament, we have both the right triangular ligament and the left triangular ligament. The left triangular ligament comes as a combination of anterior coronary ligament and posterior coronary ligament coming together to form the triangular ligament. It means in the left part, some anterior coronary ligament comes from this side. Then the posterior coronary ligament also originates from here. Then they combine at this apex. This is what we call apex of the liver. They combine at the apex and form the left triangular ligament. Then on the right side, still the right anterior coronary ligament and the left anterior coronary ligament combine. Actually, here they combine like in this drawing. The coronary ligament comes this way, the anterior comes this way, then the posterior comes this way, and they combine in here, meaning they will leave the bare space in the middle. They leave the bare space in the middle, then they form the right triangular ligaments. So those are some of the ligaments. However, we also have the ligaments that are formed by the lesser omentum. The lesser omentum. In the lesser omentum is the part of the stomach that originates from the stomach that connects it is just like a connection of the stomach and the liver. It's a connection of the stomach and the liver. From the lesser part of the stomach, then it joins to the liver. In this on this lesser omentum, we shall have the two ligaments on the lesser omentum. The two ligaments we have hepatogastric ligament and hepatoduodenal ligament. The hepatogastric, as the name says, hepatogastric ligament connects the liver to the stomach. Then the hepatoduodenal connects the liver to the duodenum. The hepatoduodenal part comes to the portal triad, connects the portal triad originates from the portal triad, goes directly to the duodenum. Then hepatogastric originates from ligamentum venosum and goes to to the lesser part or the lesser side of the stomach. It is where in this hepatoduodenal part or the hepatoduodenal ligament, it is where we find this hepatic artery passing the hepatic artery, and the hepatic artery can just transverse it. Then the portal vein will move along this hepatoduodenal ligament. Then the next one, we can talk about the segments of the liver. From all this work, we have discussed that the liver has two functional lobes, that is the right lobe and the left lobe, separated by the fusiform ligament. Then that is now to the diaphragmatic side. When you go to the visceral side, it is the left sagittal. It is the left sagittal fissure that is going to separate these two on the visceral side. But on this diaphragmatic side, we have this fusiform ligament separating the left and the right lobes. Then anatomically, we say that the liver has 4 lobes. The 4 lobes, we have the right lobe and the left lobe. The right lobe being the largest or the biggest lobe, then the left lobe being the smallest with an apex. Then amidst there, at this side, between ligamentum venosum and inferior vena cava, the fossa of inferior vena cava, we have what we call the caudate lobe. It was named so as caudate lobe because it is formed posterior, as if it is like a tail. That's why it was named as the caudate lobe. Then this one between the ligamentum teres hepatis and the fossa of the gallbladder, we have the caudate lobe. So those are the 4 anatomical lobes of the liver. Then we discussed about the relations, where we have the gastric area, we have the colic area, we have the renal area, we have the suprarenal part, we have the bile area, and others. Now let us talk about the segments. The liver has 8 segments, named number 1 to number 8. The liver has 80 segments. The segments of the liver, the right part or the right lobe is divided into 6 segments, and the left lobe is just divided into two segments. Where we have the line bypassing here, the line that is now transverse to this way. The first thing, this one is the median. We don't talk much about it. The first lobe is found at the posterior side, which we term it as a caudate lobe is our first segment. The caudate lobe on the posterior side is our first segment. The second segment is this. The third segment, the fourth segment. The fifth is we name them in what we call clockwise direction. Where we shall have this. This one is found at the right part. But being at the right part, we shall call it right.